The tendency to engage in social interactions and to be present in these situations comes naturally for many people. However, for some, engaging socially with others can be a nightmare. People who suffer from social anxiety disorder are overly conscious of their actions in public settings. The nagging feeling of being judged or scrutinized for all actions is usually present. People with social anxiety become wary of their actions, and this social discomfort makes them experience symptoms such as nausea, constant sweating, trembling, shaking, escalated heartbeat, or dizziness. While this problem seems cruelly undermining, mental health professionals can still treat it successfully. In this video, we will discuss some treatment options that might help sufferers of social anxiety. 1. Psychological therapies. Psychotherapy typically involves a one-on-one talk therapy session between a professional counselor and a patient. Talk therapy, commonly cognitive behavioral therapy, is an excellent treatment procedure for people with social anxiety disorder. Today, many organizations recognize the need for increased mental health awareness and have provided mental health services and options for their employees and members. In fact, at-home online therapy is now currently available and is as effective as in-person therapy sessions. There are various forms of psychological therapies that doctors can use to help treat patients. Psychoanalysis, acceptance and commitment therapies, and cognitive behavioral therapies are the common forms of treating social anxiety. These therapies allow a qualified mental health professional to create a plan of action, countering the disorder, and instills and helps to build healthier habits. 2. Training. Training the mind to accept and adapt to social situations, rather than escaping them, creates an impeccable pattern of adaptive habit. Therefore, patients become more responsive rather than reactive to social situations that trigger their social anxiety. Training patients involves practicing unwavering eye contact when engaging in conversations, or applying relaxation techniques in situations that may trigger social anxiety symptoms. Training helps to acquaint people with their worst fears and allows them to overcome them when facing them in real time. 3. Support groups. Support groups are a comfortable and engaging form of treating social anxiety. Not only will individuals get a chance to practice their social skills in a safe space, they can also learn from others who also suffer from social anxiety. They will be exposed to different perspectives from others who have had similar familiar experiences. Those who have had success in overcoming some or all aspects of the disorder can offer unbiased solutions without judging their counterparts. Patients can quickly relate to each other's experiences and quickly learn the subtle techniques to overcome the condition. Support groups can range from a few individuals to considerable numbers of patients guided by a qualified mental health professional. Depending on a patient's comfort level, they can opt for larger groups to expose them to more diverse crowds, or smaller groups that offer more intimate interactions to practice in communication. 4. Medication. While talk therapy is an effective form of treatment, medication can be effective for certain individuals. Medication can help socially anxious people manage symptoms of the disorder by suppressing them through restricting intractable hormonal production. Typical types of medications include antidepressants, such as selective serotonin reuptake inhibitors that can be effective in as little as a few months. Also, anti-anxiety medications can offer short-term solutions. However, their downside is that they induce dependence and can lead to death when patients abuse them or simultaneously use them with narcotics and/or alcohol. Beta blockers are also another form of medication that can alleviate the physical symptoms of social anxiety. Symptoms such as sweating, nausea, or escalated heartbeat can be lessened. Beta blockers can help a patient feel better and help patients engage in social interactions without worrying about any of these common symptoms showing up unannounced. 5. Complementary treatments. Patients can also practice other complementary treatments such as yoga and utilizing dietary supplements, apart from therapies and prescribed medications. Yoga sessions guided by a specialist can help sufferers of social anxiety to focus on their thoughts and control. Most sessions focus on practicing mindfulness. Mindfulness helps one to focus on the present and acknowledge their fears while appreciating their existence. Passionflower and rhodiola rosea supplements can also be utilized to help combat social anxiety. Other complementary treatments include aromatherapy, where patients use lavender to treat the disorder. In the contemporary world of rampant mental health issues, people who suffer from social anxiety usually suffer in silence. Although this problem can be genetic, some people get it through emotional trauma and environmental influences, including domestic violence and family conflicts. However, the silver lining is that treatment is available through numerous treatment options. Although these treatments usually take time, managing the symptoms through simulating social activities will help to familiarize sufferers with social situations. Sometimes taking the first step is all you need to experience the life you truly want and desire. Do you suffer from social anxiety? Share your story with us in the comments. If you enjoyed this video, then don't forget to hit the like button, give it a thumbs up and subscribe to our channel. Spread the love and send this video to at least 2 friends or your favorite group chat. Sharing is caring after all. Be sure to hit the bell icon to stay up to date with our latest videos. Remember to be polite to yourself first, so you can be polite to others. Take care of yourself. Until next time.